96. A 22-year-old healthy African American woman presents with a recurrent growth on her right thigh. She has a childhood history of a third-degree scald burn to the same area that did not require grafting. The growth was completely removed 2 years ago. On physical examination, there is a 5 by 2 centimeter raised, irregularly shaped purple lesion with a smooth top. Which of the following is the most likely diagnosis? A. Angiosarcoma. B. Malignant melanoma. C. Squamous cell carcinoma. D. Kaposi sarcoma in E. keloid. The answer is E. keloid. 97. A 19-year-old man presents with a skin and soft tissue infection after sustaining a human bite to his left arm in a bar brawl a week prior. Which of the following species of organisms is most likely to be cultured from the wound? The answer is A. Peptostreptococcus. 98. A 65-year-old man sustains a 50% total body surface area burn while burning trash in the backyard. The patient is started on crystalloid fluid resuscitation using the modified Brook formula. What's the rate of crystalloid fluid formation? What's the rate of crystalloid fluid administration given in the first 8 hours? So we'll calculate this, and the answer is 500 milliliters per hour. 99. A 67-year-old man presents to his primary care physician with a 1 centimeter skin lesion on his left forearm. On examination, it has a waxy appearance with rolled pearly borders surrounding a central ulcer. Which of the following is the most appropriate management of this patient? A. Mohs surgery. B. Curettage. C. Electrodesiccation. D. Laser vaporization. And E. Surgical excision. The answer is E. Surgical excision. Number 100. An 18-year-old man sustains an electrical injury with contact points on his right hand and left leg. He presents to the emergency room awake and alert. Which of the following is not associated with electrical burns? A. Compartment syndrome. B. Seizures. C. Arrhythmias. D. Neuropathies. And E. Cataracts. The answer is B. Seizures. 101. What is the most likely diagnosis of a painless ulceration over the left medial malleolus with surrounding brawny induration? Answer. The most likely diagnosis of a painless ulceration over the left medial malleolus with surrounding brawny induration is venous stasis ulcer. 102. What is the most likely diagnosis of an ulcer over the lateral aspect of the right fifth toe in a patient with a history of diabetes mellitus with pain in the balls of the feet at night? Answer. The most likely diagnosis of an ulcer over the lateral aspect of the right fifth toe in a patient with a history of diabetes mellitus with pain in the balls of the feet at night is in ischemic ulcer. 103. What is the most likely diagnosis of a lesion arising in a burn scar? The answer. The most likely diagnosis of a lesion arising in a burn scar is a Marjolin ulcer, which is a squamous cell carcinoma that arises in a chronic wound. 104. What is the most common malignancy involving the lips? Answer. The most common malignancy involving the lips is the squamous cell carcinoma. 105. What hematologic abnormality is associated with silver sulfadiazine? Answer. Silver sulfadiazine, which is used as prophylaxis against infection of burn wounds, is associated with neutropenia, likely due to neutrophil margination. 106. What is the major side effect of mefenide acetate? Mefenide acetate, which is a topical antimicrobial used in treating burns, is associated with metabolic acidosis secondary to inhibition of carbonic anhydrase. 107. What are two complications associated with silver nitrate? Silver nitrate, when used topically over a prolonged period of time for burn care, can cause hyponatremia and rarely methemoglobinemia. 108. What is the primary treatment of hydrofluoric acid burns? Answer. Hydrofluoric acid burns are primarily treated with calcium gluconate, topical calcium gluconate gel for burns, and intravenous calcium gluconate for systemic symptoms. 109. What is the typical sign on physical exam associated with toxic epidermal necrolysis? Answer. The Nikolsky sign is associated with toxic epidermal necrolysis. The Nikolsky sign is characterized by separation of the epidermis from the basal layer with rubbing. 110. What is the total body surface area burned if the entire back and bilateral buttocks have second and third degree burns in an adult? Answer is 18% total body surface area.